Hey, quick question. Are you willing to pay out of pocket or pay more for healthcare insurance because of your beliefs? Stay tuned and find out why I'm asking that question. Just looking at an article here, and like most, I don't necessarily rehearse what I see. I look at the article and I'm just reading it live with you. So let's see what it says. I have no idea what it says, but we're gonna see. And this article here is through the Chicago Sun-Times. And this is an article that actually came out yesterday, December 7th. Headline says, yes, the willfully unjabbed, let's say, should pay a price, but not out of pocket for hospitalization, as one legislator has proposed. Instead, employers could charge more for health insurance. So are they trying to set up higher pay health insurance for the unjabbed? It says, like a lot of other people, we're out of patience with the willfully unjabbed. A safe, highly effective jab has been available for months, yet some still refuse for no discernible reason other than mulish stubbornness. Stubborn now, okay. To get the shot and protect themselves and others around them. So we fully understand the frustration of State Rep Jonathan Carroll, Democrat, Northbrook, who on Monday introduced legislation that would amend the state's insurance code and require people who remain unjabbed by choice to pay their hospitalization costs out of pocket if they contract the big C-19. With infections on the rise and tens of millions of people in poor countries begging for the jab, so they say, it's hard to read Carroll's proposal and not think, good, let them pay. Our patience is worn thin, but not that thin yet. The willfully unjabbed undoubtedly drive up healthcare costs. Between June through August this year, preventable hospitalizations costs for the unjabbed reached $5.7 billion, according to the Kaiser Family Foundation. Really? Okay. So we're supposed to believe these numbers, even though every other number out there has been flawed, let's put it that way, has been incorrect, has been inflated. We're supposed to believe this. Okay. But forcing the unjabbed to pay for hospitalization on their own is a bad idea, as well as a violation of the Affordable Care Act. The Affordable Care Act, okay. For one, no desperately sick person should have to risk access to life-saving medical treatment because they cannot afford it. Second, it's a slippery slope. First, it's the unjabbed paying their own hospital costs. Next, it's requiring smokers who refuse to quit to pay for their own lung cancer treatment, or the overweight paying out of pocket for knee replacement because the excess weight wore down their joints. Now that is a little bit true. I mean, where will it stop? Because if they force the unjabbed, as they said here, to pay for their own hospital treatment out of pocket, I mean, that is true. You know, will it at some point require smokers who refuse to quit to pay for their own lung cancer treatment? Or the overweight to pay out of pocket for their own knee replacement because of excess weight wore down their joints? That is true, that part. When will it stop? Because I'm telling you right now, if they let one thing slide, it's going to open up basically a Pandora's box. Or it's going to open up a can of worms, or however you want to say it. Affordable Care Act and other federal law, plans and issuers may not discriminate in eligibility for benefits or coverage based on whether an individual obtains a C-19 jab, according to an October bulletin for the Centers for Medical and Medicaid Services. See, basically articles like this, the average person will read this, and really, I would say subconsciously it causes division once again. Because when you first read this, it's basically still putting the jabbed versus the unjabbed in a sense. And they're trying their best to make the unjabbed feel uncomfortable. They're doing it every single way. So they're kind of putting it out right now that at some point, the unjabbed, either they're going to pay more for their health care insurance, or they're going to have to pay out of pocket for any kind of health services provided. That's what they're doing. And the thing about it is, they say it's stubbornness. No, it's common sense. And we know that we can't trust the numbers because we've been lied to at least for the past couple of years, right? Or almost 2 years. So why would someone, get that jab? Just my opinion. Anyways, what do you all think about that? The unjabbed possibly having to pay more in healthcare insurance or having to pay out of pocket because they decided to do their own research and find out that the jab is not necessarily the best thing or the best alternative. Anyways, leave your comments below. Give the video a thumbs up, and also please subscribe to the channel. And as always, get ready, stay ready. God bless.